Okay, so this is a great technique for torticollis or wry neck, or anyone who comes in with any acute spasm or pain in the neck. The technique we're going to use is a positional release technique with compression. So what we do is we find through palpation and assessment the point where they are the most tender or the most irritated. It might be over a cervical facet joint, it may be one of the muscles that's in spasm. You can identify that through your palpation. And let's just say it's the scalene here, its attachment up onto the cervical spine. I can compress that, find that tender point. Don't elicit too much pain, we don't want to create any more spasm out of that, but just find that tender point and then we close down the tissues and the joints around that. So we compress that with a fingertip, then it might be extension, lateral flexion, rotation. You can play with the movements, but find the position where the tissues feel like they're softening under your finger and the patient reports that there's less discomfort or pain as a result. Then once you maintain that compression with the fingertip, hold that closed down position, and then from there apply a gentle compression through the top of the head to further close down that facet joint and shorten those tissues. And then in that position it should be completely painless or very close to painless, and then we hold that position for about 90 seconds. After that minute and a half or so, we then relax, reduce their compression, gently move them back into neutral, reassess through palpation for the tension or the pain, and then ask them to move and see if that's changed the position or change the discomfort. If it hasn't, we can then go to the level above or below, or continue to search for those tender points, and then just through exploration, playing with the movement, try to find the best position that shortens those tissues, decreases the pain, and then we can compress down through the spine, decrease even further. Again, wait that minute and a half. Come back out of that, gently, passively move them back into neutral, reassess, and you'll find that that's a really effective technique because it's not provocative for them at all. If anything, it reduces the pain for them. A great technique for acute spasm and pain in the cervical spine.